I don't know, it's just getting stuff out. And I think getting stuff out is human. And if there's any motivation for that at all, on a conscious level, I think that comes not specifically to let parents know about the human side of me or what we face, but also my colleagues.
Hi, everyone. Welcome to another episode of The Next Step. I'm Jeff Kozlowski, your host. For this episode, I'm joined by our very own Dr. David Korones, a longtime pediatric oncologist and palliative care physician here at University of Rochester Medical Center. He also did his residency here at the medical center from 1984 to 1986, and then a fellowship from 1988 to 1991, and basically he never left. He spent his career not only caring for children with serious illness, but also writing powerfully about the human side of medicine. And in this episode, we talk about what compels him to write, how he balances vulnerability with professionalism in his writing, and why it's so important for physicians and researchers to find ways to share their work and their perspective with the world. Here he is, Dr. David Korones. Dr. David Korones, thank you so much for joining. How are you?
I'm good, thank you.
Pleasure to have you on. I guess first, can we just start by hearing a little bit from you about who you are and what you do?
Sure. So my name is David Korones. I have been here a long time, largely because I like it here and I like what I do. I am a pediatric hematologist oncologist, and my area of focus within that realm is children with brain tumors, and I'm also a pediatric palliative care physician.
So you mentioned you've been here a long time. If I have this right, let's see, I'm looking at your ECV here, residency through 86, and then back for a fellowship through 91, and then you just never left?
Never left. Never left. Yep.
And what made you decide to stay?
Well, I mean, there are a number of factors. Probably the biggest one is my wife and I had the rare experience of childhood of each of us separately grew up in the same place, stayed in the town we grew up with and all the way through high school. And in doing so, it gave us a firm sense of home and community. And we wanted that for our kids, too. We had ambitions, but our biggest ambition was to give our kids a good home and a sense of home and community. It helped that we both happen to love the work we do, and U of R has treated us well, and it's been a wonderful place to have a career.
So you and your wife are from the same town originally?
No, actually, yeah, I know I said that sort of in a confusing way. We're from completely different areas of the country.
Got it.
But each of us independently grew up in spent our entire childhood in our respective communities.
I see. And where's that? Where's home? Your original home then? Where are you originally from?
Original home is Memphis, Tennessee.
Okay.
So I actually was born in New York City, but I was moved down to Memphis when I was 6 months old, right about when Elvis recorded his very first record, not too far from where I live.
Yes. Yeah. Very cool. You were close by.
Yeah.
So what drew you to pediatrics then?
Good question. In medical school, as you know, in medicine, it's when you're making career decisions, it's kind of a series of unrelenting, somewhat arbitrary choices because you don't really know if you've made the right choice until you get into it. So for me in medical school, it was either surgery or pediatrics. And I liked them both because they were both areas where kids were sick, but you could get them better quickly. pediatrics in particular, but pediatrics won out in part because I just love working with kids every day. I mean, they just keep you so humble and they're so much fun, even when they're sick and facing tough roads. They're just so wonderful and inspiring. But the other thing is, I knew early on I liked pediatricians, and that I knew that my personality profile was going to be a better fit for pediatric colleagues than surgeons. I'm just not a surgeon type, which is not to disparage surgeons in the slightest. I just knew that it wasn't my world or culture.
And are you a parent yourself?
I am.
Do you find I'm just curious, working in pediatrics and working with children who are sick, does that does that have an effect on your parenting at all and how you kind of I don't know looked at being a parent or looked at having kids? Just curious.
Yeah, it definitely had an impact. I think you can be a pediatrician and not have kids and still be an awesome pediatrician. I don't think that's a job requirement. On the other hand, I did part of my training before I had kids, and then when I had kids, it just changed everything. It just helped me understand parent perspective. And I just remember thinking, oh, now I get it. So many times because there's just nothing like living with a kid to get the full experience and understanding.
Absolutely. So what main reason we're here to talk today is to talk about your writing and um, you mentioned understanding the parent perspective, and I've noticed, in at least some of the pieces that I've read that you authored. We'll talk more about some specifics in a little bit, but a lot of it, I think, has a theme of being human as a doctor, understanding where parents are coming from and why they make the decisions they do or why they want to go one route versus another. Just can you talk about just the importance of having that perspective and seeing sort of the parent side of it, the human side of it?
Yeah, I'm glad that you asked that and that you did pick up that in the things I write that I'm showing the human side of it. That's not like a conscious effort or anything. It's just, I don't know, it's just getting stuff out. And I think getting stuff out is human. And I, if there's any motivation for that at all, on a conscious level, I think that comes not not specifically to let parents know about the human side of me or what we face, but also my colleagues. Because I grew up in an era where it wasn't cool to share your uncertainties, your doubts, your guilt. And I gradually learned through the years that I wasn't alone, that I wasn't the only one who beat myself up over decisions that I made, or that, struggled with making medical decisions, or who grieved when things didn't go well. And so by getting that out on paper, it was my way of number one, getting it out, but also letting my colleagues know, hey, it's okay to share this stuff. I know that I have a sense that you're feeling it too, and you're not alone. And then, I think I wrote early enough in my career that it was when there wasn't general public access to write to what we write in the medical journals, and I think now things get around in a much more in a quicker and more widespread way. And I've also learned that that's something that parents are grateful for, to read that their doctors or doctors in general are not robots. That and that we are like them, imperfect human beings, but also feeling human beings with heart, and that that's so important to them. I don't know.
Yeah,
Yeah,
go
yeah.
ahead.
No, just to know that their child is not just another case, that their child matters.
Yes, and through some of your work, you mentioned going to funerals of children you've cared for that have passed, or also just feeling and in the good times and celebrating with families, or rejoicing that someone is healthy again, and just sort of being, having taken care of them for so long, maybe kind of feeling part of the family. And like you said, I'm sure that goes a long way with parents and other physicians. So when when did you first start writing? And what sort of, what was your thought process and finally thinking like, I need to get this out somehow, and I need to write about this.
Yeah, it's like much in my career, it's sort of things I stumbled into and not by design. I'd love to say I had an organized game plan for life, but it hasn't worked that way. But that's okay.
Yes.
So I would like in high school, and I was just terrible at writing. I just didn't like English. I like math and slide rules and things like that. So it's hard to believe that I write now. I think probably some of my writing skills sort of evolved naturally from having to write in the medical record. And this was not any formal writing. This is just what we document every day about our meetings with patients. And I learned that people who read them, the best way to communicate through writing in the medical record was telling patient stories as that, not just a templated series of facts, but just telling their medical story and introducing the human side of that story in it. And then, I think it was late 90s or early 2000s. You mentioned the story I wrote about going to a child's funeral. And I had never written anything for publication before then. And there weren't that many venues in the medical journals for that kind of thing. But JAMA is one of the few medical journals that had something for that. And I didn't write it with an intent. I don't think I had an intention to send it to that specific place, but I went to the funeral of one of my patients, this 3-year-old boy whose parents just, you know, uh, took such beautiful care of him. He had a brain tumor, and no matter how hard we tried, he just it just kept growing, and he eventually died. And I I can't always go to my patients' funerals, but I do try to go. And this one happened to be in this little wooden church nestled in the southern tier in the Finger Lakes region. And I think it was in March, and there had been a gentle snow that just that was falling and was clinging to the leaves and on the ground as I left. And it just there was such a feeling of melancholy, but also coupled with this sense of completeness for having been able to grieve with them and a sense of community that I just grabbed my on the way home. I grabbed my dictaphone because we would that's how we would write our notes for our secretaries to type. And on the way home, I just wrote about this experience. And then when I got home, I transcribed it and turned it into an essay. Uh, and lo and behold, JAMA took it. And I guess that launched my writing phase of my career.
And so now, what kind of motivated me to reach out to you was just, some of your last couple publications. Um, One, talking again, we mentioned earlier just kind of the human side of medicine, and working with a family who was their child was going through, I believe it was a clinical trial, and they really were clinging on to hope that these drugs were going to work, and you met the family halfway to give them the last dose. They were coming from Toronto, I believe, and um, just because you saw the sort of hope that that gave them, and then there was another one on the, I guess, kind of flip side of things. Um, I'm I hope I'm not going to blank on the title. I'm mad as hell, and I won't take it anymore.
Yeah.
And just expressing frustrations for working with insurance companies. So what, I guess, what inspires you in your writing? Is it just like if you have a strong feeling about something? I mean, obviously, it's a obviously, patient stories are one thing and can certainly help a lot of people in that kind of writing. But is it just something that either you get a strong feeling about, or what inspires you when you decide to write?
Yeah. Good question. Another thing that's not calculated, that verbal just kind of surfaces. I would say more than anything, it is just a very meaningful and powerful interaction with a family where they just touch me in a very deep and personal way and make me think harder about them and the profundity of the issues we deal with them, and teach me to be better at what I do and help me to recognize that we're human beings from different walks of life and different perspectives who have been brought together and had an impact on each other. So it's often more dramatic situations, and I don't. It's not always like one thing I wrote was based on a very ordinary question that we get asked all the time, called "What would you do if it were your child?" And I mean that, um, and maybe that's it's a question parents often ask of us, but how hard do we think about it, and what do they mean when they ask us that, and you know how do we respond, or how should we respond? So it's not always something super dramatic, like the one you just referred to, but it all boils down to hard and moving conversations with families, and feeling enough emotion, and that there's lessons to be learned for me and for us all, and hopeful that putting it on paper gives it some meaning. Now, the mad as hell thing, or did you want to ask?
Please.
The mad as hell thing is a little different. So you're referring to this paper I recently wrote called "I'm Mad as Hell and I'm Not Going to Take This Anymore."
Mm-hmm.
And that was not so much about our patients, although it is. That's what everything boils down to. But how we are besieged by denials from insurance companies, um, uh, that stand in the way of us getting our patients the medications we need. It just happens so more and more often, and takes up more and more of our time. And I knew that it's a frustration that not only drove me crazy, but drives my colleagues crazy as well. And I wanted to put it out there. I tell the story of one specific patient, and the lengths I had to go to get her the medication I felt she needed. And I wanted to put it out there, again, to share with my colleagues because I know they could relate to it, but also as a sort of advocacy to say, hey, you know, what do we can't just take this sitting down. These are hard medical decisions we're making, and it's for us to make those decisions, not insurance companies.
Let's go back quickly to the "what would you do if it were your kid" question. I did see that article, and obviously people can go read the article, and it's probably a much longer conversation than we might have time for. But I am curious. Yeah, once you mentioned that, and I saw the article, it's like, yeah, I guess if I were a parent with a child in that situation, I would. I don't know if I'd probably wonder that too, And I am a parent now. I have two kids of my own, and thankfully they're both healthy. And but if I guess that probably does come up a lot for you. And is that is that a tough question? Like, how, because I guess you probably have to put on your parent hat, your clinician or your physician hat, what is that kind of when you get that question? Is it just like sometimes? I guess it probably depends on the situation, but it's probably not as easy an answer as some might think it is.
It's not. It's not, and that's why one of the reasons I wanted to write about it. First of all, I think if a parent asks us that, what do they mean? And I think it's sort of obvious. They want to know, would you do the same thing that you're recommending with the child that has, a child you love who has, who means so much in your life, more than anything. And if you would recommend the same thing for that child, then you make me feel better about what you're recommending for my child. And I've even asked parents, and that, of course, that's what they mean. I guess that part's not rocket science. But then answering it is a real challenge because I think there's rational medical decision making and there's emotional decision making, and I think there's a place for both. But when a family asks me what I do if it was my child, I have to put myself in their place as a father, as a parent, not as a physician, and that's where I'm thinking more emotionally. And so it's a little hard for me, not having ever been where they are, to know how I would respond. So I usually tell them that, I feel blessed that I'm, and lucky that my children are healthy and that I'm not in the position you're in. And I don't know exactly how I think it'd be naive of me to know how I would respond. But if you'd like to know what I think I would do, um, then here's what I think I would do if it was my child. Because I think if they ask that we shouldn't cop out, that
Mm-hmm.
they deserve an answer. And so I give them an answer which is my best guess.
Mm-hmm. And then going back to the writing piece now, you know, we we just talked about the piece you wrote on working with insurance companies, and I speak with some of our graduate trainees, our PhD and master students who, do a lot of research and are some are thinking of ways to kind of put themselves out there. They want to talk more about their research, or and a lot of sometimes it's just they don't know where to start. But a lot of times it's just I guess it's today's climate and just the world of social media. But a lot of folks are just, I think, nervous for backlash, for just response they may get, whether it's posting facts about their research or an opinion on their research. Everybody, which is, I think that's valid, right? I mean, it's people have a response to anything now, and social media can kind of be the Wild West sometimes. But it is, as we've talked about, it's important. I always try to think and let folks know, like, your educated, data backed uh, facts and opinions are, I think, needed. But what would you say to trainees or just maybe early career researchers who are thinking like I should probably talk a little more about this work, but I'm nervous, or I don't know where to start? Any advice there?
You mean talking about their, not just writing, but just about their, whatever their work is?
Right.
Yeah, you know, I I get asked a question like this or similar things that I'm not quite sure how to respond because the easy thing for me to say is just put it out there, just do it. And I'm in the um, toward the end of my career. I know I'm not going to be doing this too much longer. We're not, none of us are immortal. And so, having, been in this for a while and knowing I'm not going to be working that much longer, I have less to lose. So
Hmm.
it's very easy for me to say, oh, just get out there and speak your mind. Say whatever you want. Don't worry about it. And that's easy for me to say. But for somebody who's just starting out, you're not as secure in your profession. You, you might not have totally found your legs. Yeah, you might be more vulnerable. You have more bosses, and you have a whole life and career ahead of you. So it's not that easy. Um, I, that said, I would advise young folks to not be too timid about putting their work out there or their opinions out there, and that if they have trepidation to, you know, do what I still do to this day is talk to colleagues, talk to family, talk to the people you love and trust, and get some feedback from them that might put you on a little more secure footing.
I love that you acknowledged that piece that you are later in your career. I was going to ask, I'm sure experience has a lot to do with the comfort level of sharing certain things, and I'm also glad you brought up kind of your how you get feedback, because when we were talking a few weeks ago in preparation for this, you mentioned like you even still before you put something out are like, I don't know if this is good, and you said you have your, I think it's your wife and your children review it, right? Is that kind of your process?
Absolutely, that's my first step, and I work on it pretty hard before I'll even show it to them. I think whether it's writing a a scientific paper or an essay or playing a musical instrument or singing, although singing I think is really that's infinite oldness. But um, you're putting a piece of yourself out there. You're allowing yourself to be vulnerable, to be judged. So it's not easy, and it's still not easy for me. That's why, yes, I have the people I love vet my work before I put it out there.
I love it. Last couple things, almost wrapping up here. I did want to acknowledge, as I was prepping for this, I stumbled upon a LinkedIn post from the University of Rochester Medical Center from several months back that says, "Congratulations to Dr. David Korones, who received Golisano's inaugural Department Humanism Award, which will be named after him, a hematologist oncologist and the director of the brain tumor program at Golisano Children's Hospital. Korones' compassion, warmth, and clinical excellence has affected everyone who has had the pleasure of interacting with him, from colleagues to patient families. And the award is named after you. And there's some lovely pictures here with the post. I just have to ask, what did that mean to you to get an award like that named after you? And can you speak on that a little?
Yeah, I mean, like I'm tearing up now.
Oh,
I was just blown away because people who know me know I'm a very easy guy to fool, and they presented this. I had no idea this was coming, and so they had a Department of Pediatrics breakfast, and everybody kept saying, "Are you going to the breakfast?" And I'm thinking, why is they asking me this? And then it just came out of nowhere, and I was just beyond moved. Yeah, I don't feel that different than anybody else, and feel lucky and privileged to do what I do and to be recognized by my colleagues like that for the thing that I think is most important in our field. It was just beyond moving.
Well, congratulations on that. Clearly, you've made a significant impact in your time here. I'm sure not only with your patients and their families, but your colleagues. So, and thank you for putting it out there in your writing and all that you do there. Before we wrap up, anything you want to get put out into the world that we didn't discuss, or did we hit on everything?
I think we hit on a lot, and I appreciate the opportunity to emote a little and reflect on the things I've done and tried to do through the years. I'm grateful for this opportunity.
Well, thank you so much, Dr. Korones. It's a pleasure having you on. Really appreciate your time.
Thank you.
Thanks so much for tuning in to the latest episode of the Next Step podcast. If you liked what you heard, please share with other members of the University of Rochester community or anyone you think could benefit from these career stories. And we wish you nothing but the best in your own career journey. Until next time.